So we're going to talk about patellofemoral pain, some reasons that it can happen and some of the things that lead into it. So I want to go through a couple questions that patients typically ask me about it. The first of which is, what is it? So with my knee model here, you can see to some extent is a right knee. I have my patella, which is embedded in my quad tendon. So we don't realize that that kneecap floats and is governed by your quad contracting. You know, whenever my quad contracts and my leg kicks out, my patella slides upwards. Whenever my knee bends, my patella slides down. So the patellofemoral pain, there are a couple theories as to where the pain comes from, but what we're looking at is that your kneecap slides up and down as your knee bends. Ideally, that path would stay straight up and down and for the most part remain in this groove that's made by your femur underneath your kneecap. So a lot of that clicking, catching, grinding type sensations that you get or pain, some people theorize is the kneecap rubbing against the bone underneath. Other people would say that the fact that structures around that kneecap are not in a balance, meaning some are tighter than others, actually creates soreness where the muscles attach around the kneecap. Whatever you want to look at as the source of the pain, typically our issue is that that kneecap is not tracking well in that groove. And there are a couple things that we look at to try and correct that. Usually with patellofemoral pain, it's a muscular imbalance. So it's not anything that requires surgery. Usually it's just you have to look at these muscles that attach around the knee, and a big part of it is usually the quad, specifically the outside portion of the quad, becoming too tight, being overused too much, and creating some of this tracking problem where the kneecap is being pulled off track. Another piece is that some people would say that the track, which is made by this groove in the femur, is actually not being positioned under the kneecap because the knee is caving inwards. So if you look down here at my knee, as I go in and out of a knee bend, ideally I would have my femur or thigh pointing in the same direction as my toe. Some people will have some collapsing through the arch of their foot or collapsing inward of their knee, which actually takes my femur from underneath the kneecap and slides it out a little bit. So it creates maybe a little bit more pressure underneath the kneecap on my femur, which is under it. So these are some common factors that maybe feed into or create this pain. Now, some other things, what makes it worse? So part of what I just talked about, right? If I don't pay attention to the way my knees are positioned as I'm bending them, if my knee is caving in a little bit as I go to get out of a chair, that can feed into some pressure along that kneecap. Some of the things when I'm going up a stair, same thing, as I go to lift myself up the step, if my knee is caving in or caving in and out position, that can put some pressure on it. The other piece is that a lot of the stuff that we do puts more pressure on our toes, and the pressure on the toes automatically puts more pressure on the front of the knee. So whenever I'm doing anything, whether it's squatting down or getting in and out of a chair, if I can sit my weight a little bit more back onto my heels, now I'm not relying as much on my quad, and I'm getting some help from my hamstring and my hip. So some of these little things where I focus on putting more pressure onto my heel also take some pressure off the front of the knee. So as far as daily activities go, when you're sitting up from standing, when you're going up a stair, even when you're walking, trying to take a little bit of a longer stride, so I'm getting that heel to strike the ground versus a shorter stride where I never quite get to my heel progressing me through my step. So what can I do with daily life? So that talks about a couple positions. The other thing is in regards to exercise. So as we start to put these programs together, the first thing I look at is that people with this patellofemoral pain, their primary issue is usually using their quad too much and it's tight, and they have weakness in the structures in the back of their leg, their hamstring and their hip, sometimes even into their calf. So a lot of the initial exercise stuff that we look at is geared more at the back side of the legs and giving the quad a break. So early on we'll be doing stuff to stretch your quad and stuff to engage your hamstring and engage your glute. Exercises that typically are going to irritate this, if you do them too quickly, are going to be things where you're bending your knees in a standing position. So going right after squatting too quickly, going right into a leg press too quickly, going into things like a knee extension machine too quickly or a lunge. Stuff that's a little safer, even in standing, would be more of a deadlift, to where I'm not bending my knees a lot and I'm working more through my hips. Some of the lunge positions that I'll initiate early on, instead of focusing on going into a deep lunge, I'll have people go into more of a shallow bend and have them work on more of a shallow knee bend, focusing a little bit more on balance. I could take a weight on one side of me, which would challenge my balance even more. But you'll notice that as I'm going into even this lunge position, I'm sitting more onto my heel. As soon as I start letting that knee cave forward, there's now more pressure here. And if this is already a problem area for me, this is going to make it worse. So big thing is try and avoid putting a lot of weight on your toes. Try and keep a little bit more weight on your heels, whether it's daily activities or exercise. And for the most part, trying to go after these areas that are probably a little bit weaker and not used enough in the back of your leg, and trying to get the quad to stretch out a little bit, because that's usually a big part of the problem.